In today's episode of Remedial Sex Ed, we discuss medical questions with an emergency room doctor who is also a medical lieutenant colonel in the U.S. Army. Some subjects may be considered graphic to listeners. We also discuss the medical procedure for survivors of sexual abuse when they are brought to the hospital, which may be triggering for some listeners. While Dr. Harris is a trained medical professional with over 20 years of experience, you should not interpret this episode as basis for your own personal diagnosis. This podcast is run by 3 amateurs who are looking to educate themselves as much as their listeners, and all medical conditions should be diagnosed by a medical professional in a private setting. Enjoy!
Some of you may become somewhat uncomfortable as parts of this film unfold, but I think if you listen carefully...
Nature has intended that you to be a
A healthy, happy sex life is a nuisance. Wonderful, not something terribly unpleasant. We've all experienced curiosity about ourselves and the opposite sex. Who hasn't?
Hello, my lovelies. I'm Megan.
I'm Marcella.
And I'm Colin.
Welcome to Remedial Sex Ed. This is Dr. Grace Harris.
I would like to welcome our guest for today, Dr. Colonel Grace Harris. Welcome to the show, Dr. Harris.
Thank you for having me.
Could you give a quick intro to yourself?
Okay, as you said, I'm a physician, and I practice urgent care in Salt Lake City, and we'll be starting late summer ER medicine in Northern California. That's my civilian side. Military side, verbally address me as Colonel Harris. I'm a lieutenant colonel in the United States Army, getting ready to go out on my 6th mobilization.
It's very impressive.
Yeah, very cool.
Thank you for your service.
I'd also like to inform the listener that she is not. Oh boy, what was I gonna say? I mean, you're not just some stranger. You're. Let's see. You are like the landlord to 2/3 of this podcast.
Yep.
You're the mother of one of our very best friends, and also, you know, I like to think of you as a friend. As a friend of myself.
Aww. And I've known you guys for what? Maybe not 20 years. Maybe more like 15 years.
Long time.
Watched you guys grow up.
Yeah.
Mm-hmm. Aw.
Dr. Grace actually gave me my first stitches.
What?
Yeah.
Nice.
Didn't know that.
Yeah.
Sometimes you go to the emergency room and it's good old Dr. Grace that gets to take care of you when you make a dumb mistake.
Right.
That's so cool. I have no idea.
Yeah.
So yeah, we do go back a little bit, and so I think that's why we were able to pull such a good guest.
Yeah.
Okay, so do we just want to dive into some questions, or how do we want to slaughter this?
I know
elephant?
that Colin is really excited to ask you the first question that came to his mind.
Do we want that to be the first question
Go,
or the last question?
Colin.
All right,
go.
yeah, let's
just open up with this. What's on your mind, son?
What's same thing that's always on my mind? What's the weirdest thing you ever had to pull out of a butt?
Okay. Well, let's just change that. What's the weirdest thing I got to pull out of someone's anus? All right.
You had the privilege of pulling out of a
Well,
butt?
you know, someone comes in. Let's see. I was brand new at this urgent care stuff, and a young person came in, 23-year-old man, and had something, up in his rectum that had been there apparently for a long time, probably close to 3 days. I said, well, obviously you need to go somewhere where they can sedate you and take you into an OR suite and, help get this out of your colorectal area. And he said, ma'am, I don't have any insurance, so if you can't get this out, I'm just going to go home. And I thought, hey, Jesus. So yeah, there we were. And yeah, I wasn't sure. I think what we finally figured out it was one of the Intuition giant shaver handle that's about the size of a computer mouse. I thought it was a computer mouse, but it was broken all to pieces. And I remember pulling the sharp edges out and kind of dragging them out and shredding his whole rectum, and his anus was just pretty shredded, thinking that I was wishing he'd put something in that was smooth on both sides. But he said it was, except I guess some friends had tried to help him get it out. And the sad thing was I didn't plan in advance, so after I pulled that broken pieces and the end of that backwards, pulling it out sharp way, all the stuff that was behind it was kind of a cascade of 3 days worth of feces and blood and mucus and all over my shoes, and that was the end of the shoes. Went in the trash. I think I just went home.
Oh, God.
Yeah, it
Oh,
was
God.
it was unfortunate, and when you put large things there that are tearing you up, I think the take home was his anal sphincter is not going to function anymore, and stuff just kind of leaks out.
Oh, no, really?
Think about that, people.
Oh, man.
Yeah, number one, like, just throwing it out there whenever being a part of anal play, make sure that whatever you're using has a very wide base so it doesn't get stuck inside of you.
Gotta have that flared base.
Gotta have that flared base.
Or tethered. I mean, if you have something but it's on a tether on a cord, then I think that was the concept when we came with the idea of, instead of that intuition, what if you just had really used a computer mouse? Then you just pull it back out. But then if it breaks off, I think you're... Anyhow.
Yeah, I think the major takeaway there is don't put things up your butt that aren't engineered by scientists to be put in a butt.
Well, and something you also pointed out is it sounds like he knew it was stuck in there and he asked his friend to get it out. And if it was just a friend, that's a solid friend
That is a
who will
good
try.
friend.
Right. And
But maybe don't let your friend try.
They had really tried and tried and tried to get that out. So that was that was probably unusual things that people put up their bottom. And I think most of the time they would go. Now this is in Salt Lake City, which is just the local little urgent care centers. I think the real large things would hopefully present to a better place, a higher level of care like an ER. So I'm not sure what I'll see when I start working in Northern California. Can't wait. Can't wait.
A bunch of avocados stuck up people's butts.
Right.
Have you ever had to pull something strange out of a vagina?
Oh, I tell you what, I tried, but this thing was tethered. I don't know. I remember there was a little ball that looked like it was looked like a little marble, but it was sinewy and looked like it had some ligamentous attachments. And I remember thinking, should I just cut this off? Or then it ended up to be actually attached. She ended up with the gynecologist. So that's something I considered removing, but decided not to. Let's see. People frequently come in thinking they have foreign bodies in their vaginal vault or retain things like tampons. But most of the time, I'd say 80% of the time, there's actually nothing in there. So I'm not sure what happened or why they think there's something in there or how it fell out without them noticing. But most times when we go in there and take a look, there's just actually nothing there. So that's weird. So nothing terrible that I can think of off the top of my head. Maybe just one light bulb.
Wait, a light bulb?
Yeah. Let's go back to the light bulb.
It was a Christmas light bulb. It wasn't broken. That was good. So that was no big deal. That was a small thing.
Okay, sure, yeah.
Sure. Casually a light bulb. All right. Hi, I am here to ask you all about kink. So especially when it comes to edge play, things can get a little bit dangerous in the bedroom. And I was wondering if there had been situations with autoerotic asphyxiation, or breath play, blood play, or even knife play, or even bondage, actually, because bondage can get pretty serious if you cut blood flow to a certain limb for long enough. So I was just wondering if you had any experiences with fun play gone wrong.
Anything I see is what's gone wrong. But recently there are a couple fellas that came in, and I think the logic was they had used ecstasy, believing that it would relax the anal sphincter. But one of the other side effects are you can have a lot of cardiac arrhythmias, and he actually blacked out and had a syncopal episode and smashed his face into the headboard, which is why he ended up seeing me. When you have someone with a busted up face and a nose and putting stitches in, I usually say, right before this happened, what were you doing? And that's when I got the story about the ecstasy and the concept behind it and how it can help. But I think he must have just done too much. I think we figured out he was also really dehydrated. So that was a dangerous situation where he'd actually blacked out.
In college, I had a friend who told me that she had an experience where she broke her boyfriend's jock strap once. And what she meant by that is she broke his boner during sex.
Nice.
It's horrifying.
Yeah.
Like, what? Just
That's,
what happened? What does that mean?
That is what they're referring to as a penile fracture. And that will happen when you have either a half or a full erection and you're having some pretty vigorous intercourse, and it actually is bent to the point that it snaps, and that is a true surgical emergency to get a urologist involved that can repair that so it's functioning again. But that's actually more common than you think. There
Really?
are many articles written on that, and yeah, it's absolutely no joking matter. That is one of the reasons you would actually, go to the emergency department and you would need surgery.
Oof.
Yeah, ouch.
I guess I have a question. What would be your advice for avoiding sexual injuries, or what other kinds of sexual injuries have you seen?
Oh, I think that the ones I see are the people that have had a bad experience. They've perhaps been whenever alcohol is involved, it doesn't matter if you twisted your ankle or and any kind of an accident is exponentially more severe if you're inebriated. Certainly, if you're having sex, and certainly some of the asphyxiation situations that go wrong, or if there's alcohol, and certainly mixing alcohol and drugs. I think that goes across the board to all things, not just sex play. So Colin said, leave the alcohol and drugs out if you're going to be doing some crazy and wild things, because then you have a lot more control, as you can imagine.
I'm actually really glad
Will
that
do.
we sorry. I'm actually really glad that we touched on that subject, because fetish play or kink play really isn't meant to include drug or alcohol, though I can absolutely see how that was immediately one of the first stories that came to mind when you were talking about it. But yeah, I really want to highlight you're supposed to be very much in control and very much aware of your bodies if you're going to be practicing any kinds of kink play, especially when you're talking about taking away the airflow to someone's lungs.
Correct.
So I'm really, really glad that we're highlighting that.
I think that's this. I'm not sure if this would be sex play or not, but I did see a beautiful young lady who had probably at least 12 lacerations, all in her vaginal area, her labia minora, labia majora, all of her thighs, and that was her. Her explanation was she was being marked by her pimp, and she was a prostitute. The problem was not that at all. The problem was that I discovered she had also genital herpes, and I think that for her line of business, she indicated that was pretty much a death threat, and so she was pretty unhappy and very depressed about that. I tried to contact her for safety, but I don't follow any of these patients. I'm not sure whatever happened to her, but she pretty much was sure that her career and life were over, not because of the fact that she was, her genitals were mutilated, but the fact she had freaking, herpetic lesion. Are you kidding me? Which is, very treatable. So that was heartbreaking.
Yeah, that is heartbreaking.
That's really heartbreaking. What other genital mutilation patients have you seen?
I don't know if this would be mutilation, but I've seen some penile. The first time I saw, I think it's beading, when they put a bunch of little maybe they call it purling or beading, and they inject a whole bunch of pearl-sized BBs all around the penis. So that's more like an enhancement
like a
thing.
body modification
Yeah,
thing?
maybe that. Lots of piercings that end up looking like hydrospadies, where urine comes out a variety of places. I guess probably semen comes out a variety of holes that they've made, and if they remove the piercings.
Ugh.
What? That's probably. I see a lot of things done with penises in that fashion, but mostly folks don't come in for that. They usually come in because there's some unusual rash or discharge. So that's what I see most of when I'm looking at genitals are genitals that have some type of infection going on.
Dr. Harris, can I ask you a question that maybe you haven't seen, but just as a question from patient to doctor?
Sure.
Yeah. Will you look at this? I got this thing right here.
So, growing up, there was a lot of kind of false information spread about the hymen. And I think as a young woman, I was very confused and thought that the hymen was like a cover that went over the vagina, which is clearly false because A, you would be able to see it, and B, when you're menstruating, where would the blood come out? There's beliefs on the wrong side of the internet to say that you can tell whether a woman is a virgin or not by looking at her hymen. And I actually heard when I was a senior in high school that people were talking about like hymen reconstructive surgery. Is that even remotely true?
Well, I've seen vaginoplasty where they have their vaginas tightened after maybe having some traumatic childbirth. But as far as the hymen, when I've gone in to look at hymens, it's either in a child to see if there's been any trauma. The hymen is a flap of skin that you're correct. If it's not perforated, if it doesn't have some little opening in it, then the menstrual blood can't get out. It is actually that does happen where young ladies will have to go in and see their pediatrician or perhaps an OBGYN and have a hymenectomy, where they'll have an opening made. They'll know that because they'll have a lot of cramping and a lot of pain and no menstrual flow. And if anyone will take a look, they can see it's an imperfect hymen. So that is true. As far as can you tell if they're a virgin or not? I mean, if anything, it's supposed to have a little opening in it. Depending on the size of the opening, you can figure out if something like a tampon has gone in there, or there's been some trauma and a lot of tears, and a 3-year-old, that would be inappropriate. So that's our purpose in looking at a hymen. As far as somebody wanting to see if you're a virgin or not, that's not. I think you'd have to be a virgin with a no. Somebody would have had to perforate your hymen before with a small perforation for menstrual blood to flow. But what if they use a tampon? So the answer in medicine is usually it's a whole flow chart of if you never use a tampon and nothing ever went in your vagina and you had a tiny little opening, then they do some opening of that, especially in Utah. That's popular before their wedding night, so they don't have such a painful experience with the supposed first act of sexual intercourse.
Whoa, really? I'd never heard of that.
Yeah, that's fascinating.
Yeah. That would be the hymenectomy, and I've seen that in patients' charts. And when I first got here, I thought, what is that? And then I found out that's when some doctor. I don't really agree with that technique when a doctor goes and makes the opening bigger, or makes some cuts in there so she can have a better experience. They usually go in there about a month before their wedding date, so I don't know.
Oof.
Ugh.
That's rough.
Interesting.
In the media, you will hear mixed stories of whether or not victims of sexual assault can get pregnant from sex, and those who argue that they can't say that that a woman who has gone through that much trauma cannot conceive a child. Is that true?
No, that's garbage. That's absolute garbage. So, I mean, in medicine, you can always say, well, that depends. She's not going to conceive a child if she was so traumatized and abused that she's fighting for her life, and she's near death. Then of course I don't think that a pregnancy would be carried out. But I have taken care of several victims of rape, and it's absolutely not true that they can't get pregnant.
What is the medical procedure for when a survivor of sexual assault goes into the hospital?
Oh, it's pretty in depth. We have hospitals that locally that are equipped with sexual assault teams, and they have very specific kits that are used, samples and specimens taken, photographs taken, blood work done, swabs done, urine checked, prophylactic amounts of anti-HIV, vaccinations are given, the morning after pill. I mean, there's a huge training process that leads up to being able to be a part of one of these teams. And the last time I did that was when I was deployed to Iraq, and that was back in 2011. At that time, it was only a 40-hour class. But I remember I was surprised I didn't have a lot of information on that before, with how serious and how all the variety of things that go into correctly evaluating someone who's been a victim of sexual assault.
After their stay in the hospital, is a list of local therapists and psychiatrists given to the victims so they can seek help afterwards?
Oh, absolutely, yeah. The psychological part, the psychological follow-up with specialists that deal in sexual assault is definitely a part of it. I mean, when it happens in theater, we evacuate them out of theater into a safe place. From Iraq, we would go to Germany with these people. Germany and then home.
I did want to ask about sexual assault in the military, and I'm not gonna bore you or insult you by reading back a bunch of statistics, but I'd like to suffice to say that there has been a lot of light shown on sexual assault on female service members in the military, and I wanted to know what, from a medical perspective, what programs, what's being done to combat that.
Well, sexual harassment is a daily thing that even I have dealt with on my deployments. Sexual assault is something that happens quite frequently, even overseas, even in combat zones in Jordan, Iraq, even up in Syria. So I think as a woman that I know when I'm going to send another female into a combat zone, that the female has to have separate quarters, separate toileting facilities. It's quite a extra sleeping arrangements. So in my eyes, unless I have a real cut and dried, stone cold reason why I have to have that person there, just for logistics, I usually will keep them in groups. Send the females in groups so they can all share the same facilities. And you always have to travel with a battle buddy. Last time when I went up in Syria, I had my battle buddy with me, and you're supposed to be in pretty close proximity and watch out for each other. So you are supposed to. Those things have always been in play, and I do know that the bases I've been at, it's pretty telltale that the bases that have looser alcohol policy have exponentially higher rates of rape, and not only that, but STDs, a lot of gonorrhea, chlamydia, syphilis, in the bases where they don't strictly control things like alcohol. It just seems to open up a lot of the wrong doors.
Mm-hmm. That does lead to another question I had, which is that I have seen old World War II posters and pamphlets encouraging GIs to wear condoms to prevent the spread of venereal disease. But what does sex education and that sort of thing look like in the military today?
Well, I think that what I have seen when I'm overseas and I'm usually at battalion aid stations is what we see is when someone comes in with even the slightest hint of a possibility of penile discharge, then we give them the famous shot and a shake. We just treat them for gonorrhea and chlamydia, because when you're overseas and you take the swabs or the samples, if you think you're going to send them somewhere to get those evaluated, it takes approximately 20 to 30 days to get the results back. So it's really suboptimal. I mean, you know, if of course you're not supposed to have sex when you're in combat zones. So that's step one, is general ordinance. The rules are laid out. No sexual intercourse unless you're happily deployed as a married couple and you're sharing quarters. But the rest of the folks, no sex, no alcohol, not supposed to be doing those things. So I just see it from a medical standpoint. I just see them when they come in the door with a problem.
Gotcha.
Take care of them.
So related question, could someone get an IUD when they're deployed, or continue getting birth control pills? What about condoms, all that sort of thing?
That is a good question. 100% of females of childbearing age must have a concrete method of birth control in place, documented and verified before they are deployed. Having said that, how on earth do we end up with pregnant soldiers overseas? It happens. But, you know, probably not as much as several years ago when they didn't have that. So anyone of childbearing age, when they get there, should already have the IUD put in, ideally, or at least be on some type of birth control. And we do keep that up. They're shipped overseas with enough of a supply to last the entire deployment.
From an organizational perspective, how does the Army prioritize sex and sex education? Particularly when you consider that what's the word I'm looking for? I mean, all your new recruits are likely going to be young men in their teens and 20s.
You know, that would probably be a better question for a younger enlisted person, because from my angle, I know that the places I'm sent to, there's not supposed to be any sex, and so they'll make that in the orientation. It'll be, you know, general ordinances, you know, no sex, you know, no drinking, no alcohol. Then they don't tend to, as far as the orientations I have been to, they don't tend to go into anything else about that, because you're not supposed to be having sex.
Okay.
And in some of the bases, you know, they even have cameras to make sure that you don't accidentally mess up. And you're not allowed in each other's quarters. And I'll be in female quarters. There's no males allowed in there anyhow. And you're usually bunked up with a couple of 2 or 3, if not 4 or 5 in a room. So there's not a lot of privacy. So sexual education is supposed to be no sex. I know we do have bowls of condoms all over the base, though.
Right.
Because realism?
Yeah, because of reality has to set in eventually.
Can I ask some sad questions?
Uh-oh.
Yeah,
Okay.
you may.
Yeah, they're going to be sad. What various... I don't even know how to make this more specific. What various pregnancy-related emergencies have you come across?
Oh, no. Yeah. You know, the pregnancy-related emergencies that I have been present for, the ones that stick in my mind are the ones that did not have a good outcome. For example, 28-year-old Native American, young lady with a nearly full-term pregnancy came in for no fetal movement. Come to find out, she had been abused, and the father of the baby had put his knee in her abdomen over and over again, actually, crushed the infant's skull, and that was a bad news. So the emergency was, when they present, they don't tell you all that. They come in and say, I haven't felt the baby kick or move in, whatever. The longer the worse. So, 3 days, 2 days, and that's usually going to be a bad outcome. Fetal demise, of course, is a nightmare. The later in the pregnancy, when the baby dies, when the fetus dies, and has to be delivered anyway, those are some pretty heart-stopping moments when and you you can see that. I always remember those. Trying to think if there's any other. Of course, if you're just a little bit pregnant, and let's say you're about 6 to 8 weeks along, and let's say the little embryo has implanted in the wrong place in one of the uterine tubes, then when it grows to a certain size, you'll start having cramps, and those young ladies present with. Sometimes they don't even know they're pregnant. Let's say they're maybe late on their period, and they have either left or right-sided severe abdominal, lower abdominal cramping. And that can be because of a thing called ectopic pregnancy. Those you usually, if it's far enough along, you might lose the whole tube, the whole uterine tube, certainly the pregnancy. If it's small enough, they can just use chemicals and sort of, I guess you could say, dissolve that growth that's in your uterine tube that was trying to be a baby. That's ectopic pregnancy.
So is that if like a fertilized egg doesn't drop down into the uterus?
Correct. It doesn't make it. It makes it halfway. The eggs coming from the ovaries traveling down the little tube. It gets fertilized there, and instead of continuing and implanting in the uterus, it just implants right there, and then you don't notice that until it starts growing and growing, and then after maybe a month and a half, 2 months, then boom, it's gotten so big, and it's a continuous of just bad to worse because it's continued to grow. If those rupture, then you can bleed. You can actually bleed to death. That's.
Is there any way to catch that sooner rather than later?
Yeah, if you present with that type of a pain, then you have a positive pregnancy test, then you have an ultrasound, and then you can call in the correct personnel. Usually it's a OBGYN to help out with that. But I think the key is to have index of suspicion, and it's pretty obvious. These folks, when they come in, they're not walking normally. They're kind of bent over, shuffling along. I mean, it's hard. It looks almost like an appendicitis, an acute appendicitis. When they're walking in, they're not able to walk or function normally, and the positive pregnancy test is kind of a giveaway.
While we're on this subject, do you happen to know the stats around miscarriages by term? Because you're supposed to be safer once you get to your second term. I know nothing about pregnancy. So.
Yeah. Well, depending on which article you read, the stats are approximately 70% of all pregnancies will end before term. So you have, a 30% chance that you'll be able to carry pregnancy. Certainly, the majority of those are going to be in the first trimester. And those are most likely because of some type of a defect. Something has gone wrong, and this was not going to be viable. It was not going to survive no matter what you did. And the truth is, if we knew we could just do a certain thing that could, cause us to miscarry, just like the thing the old wives tell, like don't exercise or don't eat or drink certain things, except for, not counting drugs and alcohol. But it's not as simple. So if the pregnancy is going to survive, it'll probably survive in spite of if you did jumping jacks or whatever. But if it's not viable, which is most of the time, so I think it's a lot safer to just have folks not count on it so much until they're at least 12 weeks along. I mean, I've lost one personally at 14 weeks along. So you think you're home free, and at 12 weeks you start telling everybody, and then of course the problem is then you get to tell everybody next time. Just kidding. I actually lost that one.
Did you say that 70% of pregnancies do not come full term?
Don't go to term?
Right. Those are the articles that I have that have stuck in my mind. I've seen some articles that'll say 45 or 50%. So I don't know if they're using a different group of folks. I'm talking about in the United States. I think if you went worldwide, your numbers would be totally different. So I'm just sticking to the U.S.
Can I just ask a quick opinion to the group? So I know the three of us, the hosts, were educated in public school in Utah, and Utah is culturally a lot of pregnancies all the time. And pregnancy was used as a scare tactic to keep teenagers from having sex. And so they made it sound like you could get pregnant at any given time, which we know isn't true. It's like 1 week out of your 28-day cycle, roughly, maybe.
Yeah, depends on you.
Yeah. And then on top of that, the statistic that only 30% success rate, do we actually think that it causes more problems than it solves? Because then when you have women who ultimately are in that majority who have to suffer through a miscarriage or any other reason for why the pregnancy terminates, it just puts you through more emotional hell.
I definitely think that that's a statistic that I had never heard before, and I think that should be shared more, because there is a lot of shame around having a miscarriage, which I find so sad and so shocking, because you're already dealing with the emotional burden of having lost something that you had attached and loved, and then all of a sudden there's this shame that your body wasn't capable of carrying it, which is so not right. So hearing that statistic is like, I really wish that more people were aware.
Yeah, like I said, if there's something that we could pin it on, like, ha, you ate cheese fries, or look at that, if it was something like that, then nobody would have to be taking the morning after pill or having abortions, because it'd be like, ha, I'm just going to go get some of those nachos or whatever. So yeah, the folks that I have seen and the cases I've read about most of the time there's absolutely nothing that could have been done, because it was just not viable. Mm-hmm. Right?
I feel as though in our society we try to pin sickness and illness to a specific reason for why it's happening.
How much we like to blame people. We think it's their sins.
How much of it is just, this sucks? It sucks that this happened to you, and there's no rhyme or reason to it.
Well, give me an example. Like, are we talking injuries, illness? What are we talking about?
I guess injury, there might be a little cause to blame. I mean, obviously, if you get hit by something, but I mean, if
the injury was preceded by hold my beer, then yeah, you might be to blame for that.
Like I say, what were you doing just right before that? What were you doing? Right? So that is totally people's fault most of the time. But illness, okay, so let's say you've got the flu, and you're really sick, and you've got the flu, and then, of course, I'll say, let me guess, you didn't get a flu shot. So stuff like that. This flu season in the United States, we've had over 80,000 Americans die from influenza, and the majority of those people are ones that didn't bother to get the flu shot, because the purpose of the flu shot is to prevent fatality once you get the flu, not to prevent you from getting the flu. So if you get it, you only get a half a flu, not the full blown. So in situations like that, you could say, well, it's not their fault they got the flu, but it's most likely their fault if they chose not to get immunized for something like that illness. But there are a lot of situations where there's just nothing can be done, like people who did everything they could, got the flu shot, as healthy as they can be, yada yada yada, and they still got the flu. And then of course, there's nothing you can do. You just have to try to help them out.
What's the prevalence of sex work that you see in Salt Lake City? Like, do you see it? Is it typically when a sex worker comes in and she's worried about an STI infection?
A young person that comes in repeatedly for diarrhea, test positive for Giardia, which is a parasite, and parasites transmitted fecal to oral. So the question begs to be asked, how do you keep contracting this specific type of diarrhea called Giardia? I mean, that's maybe a preschool outbreak or something like that, a campground or whatever. Turns out to be, he makes a lot of money by going down to Las Vegas, and there is an older person who pays the younger people lots of money to suction their anus. And I remember fantasizing about, can you take some of this medicine down there, and can you just put it in this person's drink so that you can kill, because this person has got Giardia, and you people are going down there and suctioning the anus, and I just bet that's how you're getting it.
I think this
It's
is
just
a
like-
really great place to mention a dental dam.
Yes. Oh, you jumped on it
Right.
before me. Yeah, episode 2.
Oh,
We we played with the dental dams, so they get the remedial sex ed seal of approval.
yeah. I think you make a lot more money if you don't use the dental
Yeah.
dam. So it has to be skin on skin.
Yeah, which is considered edge play or barebacking.
Right. So that's a person. I don't think that was really. I mean, he's an adult, and making. I said, well, I hope you're making enough to pay these bills, and that person assured me that they were making plenty enough to pay the bills. So they're just a regular, and everybody knows it. And then they come in about once every month, 4 to 6 weeks.
Dr. Colonel Harris,
Yes.
when we were texting back and forth, you said a text that I don't even know how to interpret, which is I have seen STIs in every possible configuration.
Oh,
like,
and every orifice. Yeah. Just meaning that when folks come in, when I first started working at in Salt Lake City, the folks would come in and they would have be possibly a sore throat that they've had for months and months, and they don't have strap and they don't have mono, and you have to think outside the box. So we didn't have the right swabs to test for oral chlamydia and oral gonorrhea, and that's moved right along because now we do have those. So of course you can get these things in your mouth, and of course you can get gonorrhea in your eyeball, and absolutely you can get anal chlamydias and HPV, the genital warts. You can get those all over. Herpetic lesions anywhere from in your eyeball, anus, your finger. You can get herpes just about anywhere that it can latch on. So.
Okay, so
wait, eyeball?
all this eyeball talk. Should we be recommending goggles in addition to a dental dam?
Well, I mean, I guess you could say if you're going to be accidentally sprayed in the face with gonorrhea, you might want to either do a really good rinse of it, but gonorrhea is a pretty copious amount of green discharge, so that's what you ask. Like, did you not notice that there was a lot of green discharge?
Or did you just
Red
not
flag.
care?
That's a red flag. Close your eyes. People, close your eyes. Yeah, and that stuff is treatable. You just have to be aware, and so when you go see your doctor, you have to be very blunt and honest and upfront. Say, you know what? I'm kind of concerned because there was all this green discharge. Because you have to open that up. So we use different swabs if we're looking for run-of-the-mill bacterial infection. There are different swabs for viral, like herpes, and different swabs. So if you use the wrong swab, guess what? We won't find it. Not meaning you don't have it, meaning we used the wrong swab. The wrong treatment, patient gets worse. So.
Oh, God. Speaking of discharge, so color is one way to know that it's wrong.
Yeah. I always fantasize about a nice scratch and sniff for the different secretions. And seriously, you need to learn how to pick it up.
So that
with
would be
little
very educational.
whiff. Yeah. So what if you have a lot of foamy gray discharge that smells like a dirty fish tank? What is it? Well, it's possibly trichomonas, but if you're lucky, it's just some bacterial vaginosis. Just different smell. I mean, green, we already went over this. Green is going to be gonorrhea. It's going to be
cheese match.
thick green pea soup. Trichomonas, of course, herpes is going to be a lot of painful lesions. Syphilis is going to be painless. We're seeing a lot more syphilis these days. That's your painless lesion. It looks horrendous. You have no idea what happened, and you have this giant sore in your genitals that doesn't hurt. Well, people, that's probably primary syphilis.
Syphilis is bad news.
Oh, it's treatable.
If it goes
We just
untreated.
give you 2.4 milliunits of penicillin.
Okay.
Yeah, so most of these things are treatable. I think that folks just stay home surfing the internet and imagining all sorts of things when they just come in and get tested and treated. There are better places than the urgent cares and the ERs. There are actually these sexually transmitted infectious clinics that have even a 15-minute finger stick HIV test. Those are run by the health department. So I think I refer a lot of folks to those if they want to get thoroughly tested with the correct swabs for everything.
I had heard that when you hear of women bleeding on their first time having penetrative sex, that it was more likely to be due to insufficient lube than to tearing the hymen. Is there any truth to that?
Yeah, I mean, I think that unless you're having sex with somebody who has never used a tampon, tampons are pretty prevalent, especially in the United States. So imagine if you had to put a tampon in there and then after it fills with blood, you pull it out. That's like pulling a small fist out of your vagina. And so if your female has done that, then the bleeding is most likely not from tearing her hymen. It could be, but I think that you'll know, because if you're having pretty much dry sex, then something is going to tear. It's going to be awful. Okay.
That sounds bad.
Okay.
Some women experience a lot of pain with sex. Is it purely a lubrication issue, or are there other reasons why vaginas struggle more?
I know it's called dyspareunia, and that's pain with sex, and so many reasons, from 40-50% psychological, psychosocial, actual nerve pain that some women have. There are women even have, the problem is really they have a bladder disease, but when you have sex, you're banging into the bladder area as well, and that's what's really hurting them. So I mean, there are so many legitimate reasons. Cervical problems, if they have some cervical dysplasia, and they're having sex is just like beating the cervix up, then that could cause a lot of pain. So I think that is a real thing, and that's something that needs to be seen by a specialist, a gynecologist.
What about PCOS? How do you know if the pain is coming from that or not enough lube?
Polycystic ovarian syndrome. I don't know if those folks, I don't hear a lot of complaints coming from ladies that have the polycystic ovarian syndrome. Usually the pain with sex would be of someone that has something like endometriosis or endometritis. You'll know if there's not enough lubrication. If there's not enough lubrication.
Okay, fair enough.
Anything should be slippery and wet. Okay. I think that should be pretty obvious. Yeah, and I think if it's painful, then that's why, again, if you're inebriated, then you're less likely to figure out that sensation as being bad pain. That's another reason that you don't want to, especially if you're experimenting and perhaps with a new partner.
Does douching actually help in any form? I've heard that you should only wash your vagina with water.
I'm thinking, okay? I'm thinking that the reason, the legitimate douches I have seen were women that have chronic problems with either bacterial overgrowth, BV, or yeast overgrowth, vulvovaginal candidiasis. Then there are some OBGYNs that have had them douching with a boric acid mixture that is prescription only from your gynecologist. That's a legitimate type of douche that I have read articles about and recommended to women that have chronic problems. They just cannot get their natural vaginal flora and fauna sorted out. So they're either leaning towards the end of too much bacteria or leaning towards too much yeast. As far as the commercial stuff that's sold, I've never read any article that talks about you should go and buy. And there's other projects like Vagisil. It's just garbage. It does. I don't know why. Of course, you can buy all sorts of things, I guess, that just are just garbage. But I can't think of a legitimate reason that I would put anything or recommend anyone to put anything in their vagina unless it's guided by the gynecologist. And for a purpose, you would always want to find out, why are you doing that? So you say, I'm douching because I want to smell like fresh rose petals. And you say, well, are we having a problem with vaginal odor? Then I think the way I was medically trained is you should find out, why do you have vaginal odor? right? Because there's probably a reason. A healthy person should have certainly no foul vaginal odor. So step back when you're asking yourself, if I want to buy this fresh rose petal douche, why? Why am I going to do that?
Well, I have a couple of questions for you here. From some friends of mine that would like to remain anonymous, if I could read them out to you. Stacked and Confused from Long Beach would like to know, are substances like oysters, Spanish fly, or chocolate legitimate aphrodisiacs?
Oh, good Lord. I would say a hard no on that. As far as aphrodisiacs, I think that the different things, certainly chocolate, they can release different chemicals in your brain. But as far as aphrodisiac, making you want to have sex, I think that's called Viagra for the men. Viagra for the men. And I don't know, with women, some women use testosterone products to or titrate their medications. But I have not read any articles and no medical background that would back up eating oysters. I don't even like oysters, okay?
Oh, you should give them a try.
So, funny you mentioned Viagra, because Individual One from Pennsylvania would like to know, is there an age that is too young to start taking Viagra? Okay,
again, we're going to ask the question, America. You want to take Viagra. Why? Well, I'm having a hard time getting an erection. Why are you 17 years old and having a hard time getting an erection? Okay, there's probably something wrong. I think a lot of men will possibly use Viagra because of sexual malfunction when they're in their 50s, 60s, but always you have to have a thorough medical evaluation with a specialist, for example, a urologist, especially if you're kind of young and presumably wanting Viagra because you're having difficulty maintaining an erection or difficulty getting an erection. So I can't say there's too young of an age. The youngest folks I have seen with that in their medical records have been even in their 30s are about the youngest, where I kind of wonder about that. But I have the conversation with them that I'm assuming that they have a urologist they're working with. That would be a red flag. If somebody much younger than 40s or 50s is wanting Viagra, I'd say red flag.
It's interesting. You might say red flag to this as well, but I have heard an urban legend of women taking Viagra. Is that something you're going to advise against?
I'm trying to think. Let me scroll through the brain here. Let's see. Women, ladies, the purpose of Viagra is to take the blood flow and shunt it down to the genitals, and in a male that will allow him to have an erection, but it takes the blood flow away from vital organs like the brain and the heart. And so depending on your likelihood to have a stroke or a heart attack, then Viagra is kind of a double-edged sword. Women, I'm not thinking, I've heard of women taking other things for sexual stamina, sexual enhancement, various hormones. I have not heard of women taking Viagra, but I have not researched that. I've not been asked that. In urgent care, ER, and certainly in the Army Brigade Field Surgeon, I don't write a lot of prescriptions for Viagra.
Gotcha. A Good Poke from Utah would like to know, how do you find the prostate?
Oh, I can find the prostate. So, first of all, you have to start with a male, and then using a lot of lubrication and a glove. If you very slowly set your finger on the anus, and if you wait patiently and quietly long enough and put a gentle pressure on there, the anal sphincter will stop spasming and kind of relax a little bit. Then, very slowly and gentle, you just advance. I use my index finger, which I tell my patients, you're lucky, I'm half Asian, small finger, okay? So then slowly advance, and then keep advancing until you feel something like, if you're lucky and it's a healthy young person, a little golf ball. If you're very unlucky, it's like a big, boggy, half-rotten orange that's just mushy and mushy. And if you're very, very unlucky, that mush ball has these gristly, hard, plasticky, glassy pieces in it. That's called cancer.
Ooh.
So that's how you find the prostate by going in through the anus, up through the rectal vault, and the prostate is bulging up into that. And so you feel it on the floor of that, right where the pad of your index finger would be.
Okay.
We didn't mention it in the condoms episode, but I kind of like to mention it now that for butt stuff, gloves are great. They come in non-latex versions. If you're allergic, just got to make sure to use lots of lube with those bad boys.
Anything with the butt, lube it up.
Slowly, go slowly. Come on, what's your hurry?
Yeah, it's all part of the fun.
Go slow, lots of lube.
Butt stuff.
Okay. Truly Versatile from Austin wants to know if anal bleeding due to intercourse is concerning.
You know, think about it. Anal bleeding is always concerning because your anus is not supposed to be bleeding, right? So I think if anything is bleeding, you want to find the source, depending on their age. Even if you look and there's an obvious tear, an obvious fissure, I always tell my patients, well, yeah, you and I, we see this. We hope this is it. Hopefully this will heal within the next week or two. But what if? You know, what if it doesn't? Then you can have a polyp. You can have, even in your 20s, you can have ulcerative colitis. You can have a colorectal cancer going into your 30s. There's so many reasons you can have anal bleeding. I can't think of a single one that's, okay, let's just ignore that.
Good answer.
Fair point.
Bathroom Shy in New York wants to know if it's normal for bowel movements to be different during menstruation.
Let's see. During menstruation, the most recent article I read talked about, and I'm trying to think why the hormonal changes, that right when you, the hallmark of I'm trying to remember the percent, 30%, 40%, a good chunk of women, the bowels change right at the onset of menstruation to be more of a diarrhea, a couple explosive loose bowel movements, a lot of cramping, and then the menstruation starts. As far as bowel movements changing, that's the only thing that comes to mind. The hormones are changing, and also your fluid retention is changing. And it's not. I don't think it's your imagination that for a week or two before you start your period, you kind of bloat up. That's your body getting ready to lose some blood. So you're hoarding your water and fluids, and you feel like you're bloating up. And then you release, you have some diarrhea because of the hormonal changes, and then you start menstruating. So yeah, I think the answer is yes, and I read an article recently that just mentioned a similar fact.
You've talked a lot about reading articles. How much continuing education do you have to do as a doctor?
Thus the continuing education. I mean, I use, luckily, I think the company I work for in Utah, as well as the United States military, provide me with a resource called Up to Date. So I reference those articles, and I load it on all my medics' phones overseas. It's a wealth of information. So I probably, in a 12-hour shift, I'll probably look up, easily 5 or 6 things. If I see 50 or 60 patients, there's probably at least 10%. And I'll say to them, okay, let me go see if there's anything new. And I update myself every single day. I don't know, rarely a day goes by when you're not curious about something and think of something and look it up. It's a continuous thing.
Interesting.
Take my boards every 10 years. So I did pass my boards recently. So that's something you just keep update.
Very cool. In my continuing quest to embarrass your children, what kind of sex ed talks did you have with your kids?
Yes! Best question of the night!
Oh, no. I'm sorry, kids. Here it is. Well, I remember from when my son was about 11 years old telling him, if you have sex without a condom, you will get chlamydia and your penis will fall off. So I told him that from when he was 11. And then so are you having sex? No, ma'am. Here's some condoms. So I had the talk continuously. And then with my daughter, it was, I tried to have the talk with her boyfriend about about when you're ready, and here are some signs, and if you think you want to have sex, and I think I even used a banana and said, imagine this going, and what if it don't hurt, and then come to find out, they'd already gone to Planned Parenthood, already been on birth control. Already. I was like, so I kind of, she's my oldest. I think I was a little bit in denial, thinking they were having like underwear parties in my kitchen or whatever. So I think the good thing was they did the right thing. They're smart enough, and they did the right thing. And so that was a lot easier than I thought. Amazingly easier than I thought. I don't remember. I remember her saying when I was pregnant with her little brother, I remember seeing me in the bathtub, and I remember she was a little girl, and she was saying, "Mommy, I love you so much because you're so fat." So I think we had a lot of time together. We knew about the body and the body changes and pregnancy, and I just thought it was adorable that she loved me because I was so fat.
That is great.
Yeah.
Good kids. Good kids.
I love that you felt like you missed the window on your daughter, and then all of a sudden your 11-year-old son was getting told gonorrhea. Like, your penis will fall.
Your penis, it will fall off, right?
Oh, no.
And I showed him pictures in my dermatology book. I'd pull them up online and say, look at that. That person had sex without a condom. You better believe he's 22 years old now, and he's got those condoms going on. And plus getting immunized. You want to get your kids. Both of my kids had the full vaccination series, including HPV. I think it's a 3-shot series. Yeah, so they had all that stuff.
I don't think I got the HPV.
I accidentally got 4 shots.
That's even
Extra
better.
safe.
But Colin, where do you think the women get the HPV? It's from unimmunized men.
I was a child. It was my parents' responsibility.
It's never too late. It's never too late, Colin. Here, we can hook you up. Megan, use a condom. Sure, Colin, use a condom. OMG.
Don't worry. I still wrap it. I don't. No, look at him. Would you trust him?
Not if he hasn't had HPV. I mean, I'm saying. A lot of stuff can get caught in that beard.
That's not medical advice.
Oh, sorry.
Any other advice you would like to give our listeners before we depart?
Oh, we're supposed to be talking about sexual education here, and I think that education is really powerful. I think that probably the biggest bit of advice is, instead of listening to what your friends say and they're like 13 years old, or instead of just Googling it and reading what you want, I think you have to choose some legitimate sources. So good, great. Kudos to you. Do a lot of research. Do it on sites like Mayo Clinic has a good free site. WebMD. I don't mind that at all. I just think when the 14-year-old comes in and she's got 200 genital lesions because her 14-year-old boyfriend swore up and down that his cold sore wouldn't cause any problems when he went down on her. I think stuff like that is just, I think I even said to her, you could have Googled that. You could have Googled that. Don't. Cold sore is herpes. That's my final comment. A cold sore is herpes.
Cold sore is herpes.
Well, we always try to provide good resources in the show notes to this, and I hope that our listeners take the interviews that we do with professionals as a good source of sex education, and maybe the stuff we say with a grain of salt.
I want to thank you so much for all of your time, Dr. Colonel Grace Harris. It's been super helpful having you on the show, and thank you, also from a personal note. I know you took a lot of time out of your day to sit down and talk to people that you've known since we were teenagers and awkwardly stumbling about in life.
Right. Well, that's great to hear. I thank you so much for having me. This is really exciting for me. I have a lot of energy. You guys have my cell phone number. You can text me with any questions. Forever. I love you guys.
Love you too.
I'm Megan.
I'm Marcella.
And I'm Colin.
Thank you for joining us.
You will agree that the concepts will contribute to the rearing of a mature person.
An absence of
Oh, yeah, you don't have to be thinking about sex.
that it continues